Prediabetes, the warning signs you need to know. Prediabetes is a condition that occurs when your blood sugar levels are higher than normal but not high enough to be classified as diabetes. It's like a warning sign that your body is having trouble with insulin, a hormone that helps regulate your blood sugar. Prediabetes is a serious health condition that affects millions of people worldwide, and the numbers are on the rise. According to the Centers for Disease Control and Prevention, CDC, approximately 88 million American adults, or 1 in 3, have prediabetes, and 84% of them don't know they have it. If left untreated, prediabetes can progress to type 2 diabetes, a chronic condition that can lead to serious health problems such as heart disease, kidney disease, and blindness. Recognizing prediabetes is important because it gives you a chance to make lifestyle changes and prevent or delay the onset of type 2 diabetes. In fact, studies have shown that losing just 5% to 7% of your body weight through healthy eating and physical activity can reduce your risk of developing type 2 diabetes by up to 58%. In this video, we'll be discussing the warning signs and symptoms of prediabetes, how it's diagnosed, and what you can do to prevent or manage it. Before we start, do like and subscribe our channel. What is prediabetes? Prediabetes is a condition that occurs when your blood sugar levels are higher than normal, but not high enough to be considered type 2 diabetes. It's a sort of middle ground between normal blood sugar levels and the high levels seen in diabetes. But how does prediabetes differ from diabetes? Well, in diabetes, the body either doesn't produce enough insulin or can't use it effectively, leading to high blood sugar levels. In prediabetes, the body may still produce enough insulin, but the cells become resistant to it, meaning that sugar stays in the bloodstream for longer than it should. Despite not being as severe as diabetes, prediabetes is still a serious condition that can increase your risk of developing diabetes, as well as other health problems like heart disease, stroke, and kidney disease. It's estimated that up to 84 million adults in the United States have prediabetes, but most of them don't know it. So, what are the risk factors for prediabetes? Some of the most common ones include being overweight or obese, having a family history of diabetes, being physically inactive, and having high blood pressure or cholesterol levels. Other factors, such as age, race, and gestational diabetes during pregnancy, can also increase your risk. The good news is that prediabetes can often be reversed or delayed with simple lifestyle changes like eating a healthy diet, getting regular exercise, and losing weight if necessary. In some cases, medication may also be recommended to help control blood sugar levels. By understanding what prediabetes is and its risk factors, you can take steps to protect your health and reduce your risk of developing diabetes and other related conditions. Symptoms of prediabetes. When it comes to prediabetes, it's important to recognize the symptoms so that you can take action before the condition progresses to diabetes or other health complications. While some people with prediabetes may not experience any symptoms at all, others may experience mild symptoms that are easy to overlook. Some of the most common symptoms of prediabetes include increased thirst and urination, fatigue, blurred vision, and slow healing of wounds. These symptoms occur because the excess sugar in your bloodstream can damage your organs and tissues over time. The kidneys, for example, may have to work harder to filter out the excess sugar, leading to increased thirst and urination. However, there are also some less common symptoms that can occur with prediabetes, such as tingling or numbness in the hands or feet, recurrent infections, and unexplained weight loss. These symptoms may be a sign that the nerves and blood vessels in your body are being damaged by the excess sugar. It's important to recognize and address these symptoms because, as we mentioned earlier, prediabetes can lead to serious health complications if left untreated. By catching the condition early and making simple lifestyle changes like improving your diet and exercising regularly, you can significantly reduce your risk of developing diabetes and other related conditions. If you're experiencing any of the symptoms we've mentioned, or if you're at risk for prediabetes due to your age, weight, or family history, it's important to talk to your healthcare provider about getting tested. The sooner you know your status, the sooner you can take action to protect your health and prevent the condition from progressing. Diagnosis and testing. If you're at risk for prediabetes, it's important to get tested regularly to catch the condition early and take action to prevent it from progressing. There are a few different diagnostic tests that your healthcare provider may use to check your blood sugar levels and determine whether you have prediabetes. One of the most common tests is the A1C test, which measures your average blood sugar levels over the past 2 to 3 months. Another test is the fasting plasma glucose test, which involves fasting for at least 8 hours before having your blood sugar levels checked. Finally, there's the oral glucose tolerance test, which involves drinking a sugary solution and having your blood sugar levels checked at regular intervals over several hours. The testing frequency for prediabetes depends on your individual risk factors. If you're overweight or obese, have a family history of diabetes, or have other risk factors, your healthcare provider may recommend testing more frequently. For most people, getting tested every 3 years is recommended. If you're going in for a diagnostic test, you can expect to have your blood drawn and/or to drink a sugary solution, depending on the test being done. Your healthcare provider will give you specific instructions on how to prepare for the test, such as fasting for a certain amount of time beforehand. Once you get your results, you'll want to pay attention to the numbers and what they mean. If you have an A1C level of 5.7 to 6.4%, fasting plasma glucose level of 100 to 125 mg per deciliter, or oral glucose tolerance test result of 140 to 199 mg per deciliter, you may have prediabetes. Your healthcare provider will explain what your results mean and work with you to develop a plan to manage your blood sugar levels and prevent the condition from progressing. It's important to remember that even if you don't have prediabetes now, you may still be at risk in the future. By making simple lifestyle changes like eating a healthy diet, exercising regularly, and maintaining a healthy weight, you can reduce your risk and protect your health in the long term. Prevention and management. If you have prediabetes or are at risk for the condition, there are several lifestyle changes you can make to prevent or manage it. One of the most important changes is to adopt a healthy eating plan that's rich in whole grains, lean proteins, fruits, and vegetables, and low in saturated and trans fats, sugar, and processed foods. This can help you control your blood sugar levels and manage your weight. Physical activity is another important factor in preventing and managing prediabetes. Aim to get at least 150 minutes of moderate-intensity aerobic exercise per week, such as brisk walking, cycling, or swimming. Resistance training can also be beneficial, as it can help build muscle and improve insulin sensitivity. Weight loss is another important factor in preventing and managing prediabetes. Even losing just 5 to 10% of your body weight can significantly improve your blood sugar levels and reduce your risk of developing diabetes. Stress management is also important for preventing and managing prediabetes. Chronic stress can increase inflammation in the body and raise blood sugar levels, so finding ways to manage stress, such as through meditation, yoga, or other relaxation techniques, can be beneficial. In addition to lifestyle changes, your healthcare provider may recommend medications or other treatments to help manage your blood sugar levels. Metformin, for example, is a medication commonly used to treat prediabetes and diabetes. Other treatments may include insulin therapy or other medications that help your body produce or use insulin more effectively. It's important to remember that managing prediabetes is an ongoing process that requires ongoing monitoring and management. Work with your healthcare provider to develop a plan that's tailored to your individual needs and lifestyle, and be sure to stay on top of your blood sugar levels with regular testing and monitoring. With the right approach, it's possible to prevent or manage prediabetes and protect your health in the long term. Conclusion. To recap, prediabetes is a condition in which your blood sugar levels are higher than normal but not high enough to be diagnosed as diabetes. It's important to recognize and address prediabetes because if left untreated, it can lead to type 2 diabetes and other serious health complications. If you're experiencing symptoms of prediabetes or are at risk for the condition, it's important to seek medical advice and get tested. With early diagnosis and the right management approach, it's possible to prevent or delay the onset of type 2 diabetes and protect your health in the long term. So don't wait, take action today to protect your health and well-being. Do like and subscribe our channel.